Hey everybody, good afternoon, Happy New Year. This is Dr. Sullivan back with you for our first 2018 I Care for Your Brain lecture on Facebook Live. This is an unusual time for us to be together because I got snowed in twice here in North Carolina. So thank you all so much for your patience, and I'm hoping that you can watch this on the rebroadcast at a time when it is convenient for you. So last time we were together, we talked about the dangers of cognitive screening measures. So these are these kind of quick and dirty cognitive screens that you might get when you go to the primary care doctor or even the neurologist that are just really inadequate. We talked last time about how they really aren't sensitive enough measures for a lot of people. They're really good as a starting point to consider if someone needs a more thorough evaluation or as a way to kind of open up the conversation about cognitive symptoms, but they absolutely cannot be used for diagnosis, and they really can't be used that sensitively to figure out how someone is doing with a certain treatment. They're really insensitive to a lot of very important factors. Most importantly, though, is that cognitive impairment is very complex. It's not something that you can figure out in 3 minutes. And so if we're going to talk about the problem, remember, I always promise to tell you, well, what's the solution then? And that's our focus today. So what I'm going to teach you are the 5 critical elements that have to go into a gold standard memory evaluation. And I'm really passionate about this talk because this is basically what I do every day as a clinical neuropsychologist. So who might be on your mind when you start to think about who needs a memory evaluation? Well, there's really quite a few groups of people that I think about. So first and foremost, of course, is if you or anyone that you care about has been showing any consistent concerning signs in terms of their memory, their overall cognition, so their ability to pay attention, their ability to find their words, to understand what you're saying, to process information efficiently, to solve problems. But then, of course, there's the other area of mood and behavior. Is this person acting any differently than is usual for them? And the third area is everyday life. Is this person having more difficulty doing things that will help them stay independent? And remember, I've taught you the 3 areas that you need to watch out for are driving, remembering to take medications, and being able to handle complex financial matters. Okay, so that's just kind of your broad category. Now, of course, anyone who has been diagnosed with a brain disorder, so this is Parkinson's disease, this is a stroke, anyone who has had a mini stroke or transient ischemic attack, there's all sorts of brain disorders that are very clearly associated with the brain. There's also medical conditions that really affect the brain, but we don't commonly link them up. So I'm talking about things like lupus, multiple sclerosis. I've had patients with MS come to see me, and nobody has really helped them understand how things like processing speed might be really affected by their MS. This is also things like diabetes, somebody with a history of cardiac arrest. There's so many different medical issues that affect the brain, and a proper memory evaluation can really help these people. We also think about baseline testing. So this is somebody who, and this might be you, this would be me. This is somebody who has a history, family history of something like Alzheimer's disease. So by the time we get to be around 60, 65, when we have that history, I absolutely want those people getting a baseline evaluation. 2 evaluations that I'm going to teach you about today over time is the top of the line that we can offer people, because you're then able to assess for objective change over time. And that's really important, because that's really how a proper diagnosis of dementia can be made, is we have to look at the slope from time A to time B to really see how someone is doing over time. Right? Doesn't that make sense? Okay, so why is this important? The most important thing to me about what I do is to provide people with a good map. Things like memory problems are very complex. Memory in and of itself is very complex. You have to be able to hear the information. You have to be able to pay close enough attention to be able to attend to the information. You have to be interested in it enough to attend to it. You have to be able to learn it. Then your brain makes a memory of it. Okay, then you have to be able to store the memory. Then when you want the information, you have to be able to find the information. Then you have to retrieve it. If you can't retrieve it, maybe you can then recognize it if given enough of a clue or a hint. So already I've just laid out for you 8 to 9 different levels of memory. And that's really what a gold standard memory eval has to do, is it has to get in at all those levels. That's why you can't do it with these 2 to 3 minute screening measures, right? Many times, I've told you this before, when people come to see me, even when they are diagnosed with something like Alzheimer's, there's also other things that are going on that are adding to the severity of the memory problem that's just due to Alzheimer's. So this can be a hearing problem, this can be depression, this can be not enough good nutrition, this can be confusion that's due to maybe a urinary tract infection that's not been properly identified. There's almost always layers to a memory problem, and a good evaluation is going to get as clear as we possibly can within medical certainty about what those layers are. When we don't have a proper evaluation, care cannot be focused and personalized, and I know that all of you out there are wanting and deserving that. That is really the point of me meeting with you weekly, is to figure out what can I do to empower you to be having a higher quality of life when it comes to your brain health. So this talk today is really, really important, and it cuts across all the different populations that we talk about. So aren't you dying to know what these 5 things are? Okay, so we're gonna get to that in a second, but let me just take one step back if you'll entertain me for a moment. So before you get to the point where you can actually have the gold standard evaluation, you have to do the hard work of maybe getting someone to participate in the evaluation. And that really could be a lecture in and of itself, but I wanted to just review that kind of briefly because I'm always striving to be very realistic, right? I'm kind of a optimistic realist, right? You have to deal with reality in reality's terms. We can't sit here and talk about all these wonderful things that a memory doctor could do if you cannot get the person to the appointment. So the first thing that I would recommend is to just simply be an observer over time, right? You never want to jump to any conclusions based on one observation, right? Of course, when someone does something maybe very out of character or very concerning, yeah, you should definitely be, eyes wide open and really focused. But what I really want you to do is think about observations over time. If someone actually has a memory problem to the point where we're going to think maybe it's due to dementia, what I need as a brain doctor is for you all to come in to see me and tell me multiple examples, 1 or 2 examples, especially when they happen over a long period of time. It's just not that important, because if it is a brain problem, you're going to see the problem present itself over and over and over again in different ways. So the first thing I want you to do is just gather information, right? You want to get multiple examples to be able to talk with the person about that is going to be kind of your inroad to voice your concern. The second thing is I want you to find a calm, relaxing, loving moment to bring up these concerns. This is not something that when the person is frustrated because they can't find their keys for the 3rd time in a day, that you want to say, oh, hey, by the way, we're going to go to the doctor and talk about your memory. Yeah, that's not really going to work with most of us, right? So you got to find kind of a calm, loving, respectful time to say, listen, I want to let you know I was listening to this talk today, and this doctor was talking about the importance of getting your memory evaluated. And just kind of gently bring it up. I might also want to ask the person, is this something that you have been concerned about? Try to kind of get them to buy into the conversation. I would also want to talk about the fact that there are memory medications on the market today that can slow down the symptoms of dementia. Not a lot of people know that. And I think if people knew that there was something that could be done, they might be more motivated and maybe less nervous to face the problem. The way I feel about facing the difficulty of a memory evaluation is that whatever's happening is happening whether or not we give it a name. What changes though, once we properly diagnose the specific condition, is that we actually have so much more power and control, because now we can do something about it. That's really the name of the game when it comes to memory problems. If you ignore it, it's very likely going to get worse. But if you actually see a good qualified brain doctor and they help you understand what's actually happening, you're then that much more in control of being able to actually change things. Remember what I was saying about the layers before? Yes, okay, the worst fear might be that this is Alzheimer's, and that is one of the hardest things that I have to do as a neuropsychologist, is tell people that news. But there's almost always other things that we can do that will improve quality of life, and like I said before, maybe reduce the severity of the memory problem that we could attribute to the Alzheimer's, right? So a good brain doctor always is imparting clarity and hope, right? So it's not just a depressing, sad experience. I mean, make no bones about it. Of course, being diagnosed with dementia is devastating for most people. However, when you work with the right kind of doctor, it can also provide clarity. There's so much distress that happens with memory problems when people don't understand what's going on. Even in people that I do have to tell they have Alzheimer's, many times people will tell me, honestly, there's a little bit of a sense of relief because I've known something is wrong. People's families are often, of course, sad, but also a little bit relieved because, okay, now tell me where I can get information. When something like Alzheimer's is happening in a family, people know it. People know their family members very, very well. And many times what they're craving is information, right? That's why we're together today, is to give information. People are dying for information. So you have to kind of know where to start in order to go down the right information road. So that's a huge part. Okay, so that being said, let's just assume now that you've talked to the person, you've gotten them a little bit on board, and I want you to conclude that conversation by asking if you could maybe go to their next primary care physician appointment with them to express your concerns. Okay, so let's just assume now you're in your primary care doctor's office. I want you to feel empowered to say very clearly that you are worried about memory. If you get any pushback about, well, what do you expect? This is a normal thing for an 80-year-old, or, yeah, I hear that, for any type of minimizing or invalidating, I want you to be very direct and say, what I am asking for is a memory evaluation, and this is why it's important to me and my family. Okay, you have a right to have a proper memory evaluation. They may want to do the in-house screening measures that we talked about last time, and that's fine. I have no problem with that. It just can't be the end of the road, okay? So what a physician is going to then do in the vast majority of cases is the number one step in the gold standard memory eval, which is laboratory tests, okay? This is number one. This is blood test and urine test, okay? So the American Academy of Neurology has come out with a list of measures that they want all people concerned about memory to go through kind of on the front end. So what we're really looking for here are treatable causes for cognitive impairment, including dementia. Now, I'll tell you, in my experience, this is the one area of the memory eval that a lot of people, of course, hope that there's a positive finding, because of course we all want the issue to be solvable. But unfortunately, I think the truth is not a lot gets caught at this time, but it's very important that these things are done because it's just kind of the entry point, okay? So the things that we're gonna look for are things like people's blood sugar level, right? Their glucose. We wanna make sure that they don't have untreated diabetes that's wildly out of control, that's maybe making their ability to attend and focus and make memories go up and down. Things like your vitamin B12 level, we know that when left untreated, those can definitely cause some memory problems. Things like thyroid functioning, liver functioning. In the urine, we're looking for any sign of infection, specifically a urinary tract infection. These infections are unbelievable. If you've known someone who is older or maybe even has some baseline dementia or cognitive impairment, a UTI can just send people absolutely over the top with the memory problems and confusion. So you got to have the blood and the urine, and once you get those results back, there is the idea of, okay, well, we need to go see a specialist now. So there's two specialists that are critical in the process of getting a proper memory evaluation. The first one is a neurologist, which is a physician that is a medical doctor that specializes in the brain and can do things like order MRIs of the brain, can order things like EEGs, which is a way to measure people's brain waves, and interpret those tests. They also do some really important physical examination to be able to assess for things like muscle tone and nerve conduction. The other is neuropsychology. That's me. There is a group of neuropsychologists that are called board certified neuropsychologists, and that's who I really want to encourage you to get your care from. So within that, you can actually have what we call board eligible neuropsychologists, which are younger neuropsychologists who just haven't had enough time to go through the process of the examination to be considered board certified. This is something that takes a few years. This is after your 7 to 8 years of grad school and internship and fellowship. You then also have to go through this pretty intensive process. But the whole point is that it guarantees the public, you, that we have the credentials, the knowledge, the expertise, the ethics to do this job to the level that you deserve. Okay, so those two people are your main professional allies. So I'm going to talk mostly about the neuropsychology piece because that's what I do. So the second element of a gold standard memory eval is the clinical interview, and this is such an important part of the memory puzzle. Clinical interviews are at least 45 minutes to an hour. You cannot figure out a memory problem without understanding the social context, the psychological context, the family context. We need to understand, when did this start? How has it progressed? What have you tried? What has been the reaction? What are your concerns? What is this person's job background? How is their education? How has their learning been? How has their mood been? How is their sleep? It's unbelievable the amount of things that we cover within an hour. We do an hour within my practice. What we're really focusing on in the clinical interview is one concept, which is what has changed. This is critical for a memory evaluation. If the person has always been forgetful, if they've always had a hard time with attention, and this is what we're seeing, then that's not really that concerning. What we're looking for is a change from what we call pre-morbid functioning until what we're seeing in the present day. And that is a lot. You have to find out what was normal for this person before. So when the person themselves gets set up for an interview in my practice, and a lot of neuropsychologists do this, we insist, as to the best of your ability, can you please bring us someone that is well known to you? This can be a spouse, this can be a child, this can be a friend. It's really critical that we have what we call an informant within the interview to give us critical information. You might remember that I said earlier, ask permission to go to the appointment with the person. This is for one very specific reason. Well, I should say two specific reasons. One is people are very naturally defensive about memory problems. Nobody wants to have their weaknesses pointed out. It's just very normal for people to get a little bit on the defensive when they're accused of anything, and this also includes memory problems. Number two is that for certain types of memory problems, I'm thinking of even early Alzheimer's disease, there are biological reasons that the person may not have insight into what has changed for them. So that's just kind of like a very basic dividing point in the road for me during the clinical interview, which is if the person themselves is not worried, but someone who knows them very well is very worried, that's a flag that goes up in my mind for Alzheimer's. If the person themselves is very, very, very worried and the person who knows them well is not really that worried, we actually start to think about some other things like something called pseudo-dementia or depression. Now that's just two very kind of general groupings, but I just want to give you the insight about why it's just so important that we have somebody who knows the person very, very well. It's really important for that experience to be comprehensive, right? You can't figure that kind of stuff out in a 15-minute interview. You just can't. And it's also really important that the doctor helps set the stage for a safe and open conversation during that time. We try to accomplish that in a few different ways in my practice. Of course, we have a talk at the beginning of the interview about how important it is for us to just be very forthright with our concerns, that we're very sensitive, there's no judgment. At this point, it's kind of a he said, she said. I'm here to kind of be the objective person in the middle who's just trying to find out what's going on. When someone gives me an example of something they've observed that is worrisome to them, especially if it's kind of dramatic, I always make sure to let the person we're talking about know that I'm just taking it in. I'm not believing everything the person is telling me. It's just another source of data. So it's really important that the person be made to feel comfortable during the interview, because when we get to the point of doing the testing, the paper and pencil testing I'm going to teach you about today, we really need the person to be cooperative and participating, because that's how we're really going to get the insight into brain functioning. That is going to solve this problem of what's going on. Okay, so once we're done with the interview, then we're going to move on to neuroimaging. So this is the third essential element in a gold standard memory evaluation. This is either an MRI of the brain or a CT scan of the brain. Now, that being said, it's very important to me that you understand that there is a really big difference between structure in the brain and function. And MRIs and CTs just give us structure. I have seen beautiful looking brains on neuroimaging that turn out to be having a lot of problems in everyday life. I've seen horrible brains that you can't even believe that this person is walking around, and on testing they're actually pretty fine. So the imaging in my mind is really best as a rule out. So what you can tell from imaging is make sure the person doesn't have a brain tumor, they haven't had a stroke. You can assess for the overall size of the brain, so we are interested in something called atrophy. Is there more shrinking of the brain than we would expect? Is it happening in one part of the brain more than we would like? We can also look kind of indirectly at blood flow in the brain, just get a sense of the person's general vascular health. We can make sure there's no bleeds in the brain, they don't have a skull fracture. But you really can't, unless you're doing these very high-level research protocols for MRIs of the brain, in my opinion, and in the vast majority of people, diagnose dementia from a brain scan. And why that's important is because of that distinction between structure and function. And that is complicated and gets back into this thing we're always referring to called cognitive reserve, which is basically, it's all about the quality of your brain, not necessarily the quantity. Now, that being said, there are some brain scans that can look at the memory centers of the brain specifically, called the hippocampus, and tell us if there's more shrinking there than we would expect. And then, of course, we get concerned about something like Alzheimer's. But in general, it is a part of the gold standard eval, but you cannot diagnose someone with the vast majority of dementias just based on a screen. And I say that because people will come to me and say, I don't know why I'm here. Why do I have to do this testing? They did my brain scan and they said it was normal. Okay, it's a very important piece of the puzzle, but please do not stop there. It's really not something that can tell you how the brain is actually working in everyday life. And of course, it's devoid of all humanity, right? So it's not telling us how is the person adapting, how are they coping. This is part of why neuropsychology was so critically attractive to me, because of the human element. We are not just brains, right? We are social beings. We are spiritual beings. We are people. We are not just brain scans and, brain cells. So it's an important piece of the puzzle, but it definitely does not give you your total answer. Okay, so now we're going to move on to the fourth element, and this is my favorite because, of course, it is neuropsychology, neuropsychological evaluation. This is the paper and pencil testing that we do to figure out exactly what's going on. So who are we? We are doctors of clinical psychology. We have expertise in the brain and how it works. We do a year of internship after our PhDs. We do 2 years of postdoctoral fellowship. We are psychologists. We care about the people part of this, right? Our job is to really get very clear on the contributions that are coming from multiple areas. We review medical records, we talk to the family in depth, and we do this paper and pencil testing. So let me tell you a little bit more about that. Believe it or not, the paper and pencil testing that a neuropsychologist does is the most sophisticated way that we have to look into the brain, okay? That's kind of like this really cool thing that I like about it is it kind of seems sometimes almost a little simple on the surface, right? Because we're using a piece of paper, we're using some books, we are using pens and pencils. It's not a big sophisticated protocol, right? But it really is a way of breaking down complex cognitive issues into their respective parts. And what we're basically doing is taking a little tour around the brain with our tests. And we know if someone has a problem with this one test, okay, well, you needed 4 or 5 other kind of building blocks to get to that point to do that test. If we see a problem there, we can actually kind of work backward and say, okay, well, how was the person's visual perception on that test? Okay, how was their ability to manipulate spatial images in their mind? How was their ability to remember that picture that we showed them? And we can actually get it down to where we can really pinpoint where the problem is coming from. You then look at the pattern of the person's overall test profile, and it's basically pattern recognition. There are patterns for Alzheimer's disease. There are patterns for untreated sleep apnea. There are patterns for poorly controlled diabetes. There are patterns for dementia. There are patterns for all the subtypes of dementia, depression. What we really do with the testing is compare how the person did on the testing in 2 different ways. The first is against what we would call their peers or a normative sample. So how did other 80-year-old women with a bachelor's degree do? And that kind of gets at your question of, well, what's normal for age? Then we really do something awesome, which I love, is compare how the person is doing now to their own baseline. How cool is that? We actually have tests that we can predict, well, how should this person have done on this test in their prime, right? So it's a result of how they do on some tests now that we call hold tests, which basically even people with moderate to severe dementia can do these tests okay. But we also take into account someone's education history, their work history, but basically we come up with what we think is how they really should have done on the tests. So the comparison really becomes, okay, remember that whole thing I talked about before, change, right? What is different for this person now that would be normal for them in a given situation? We are also, of course, looking at things like their mood, how they're doing in everyday life. We are also giving questionnaires to the family. Remember what I was saying before about how it's so critical to get the real scoop from family members? Well, sometimes we can tell we're not going to get it in the interview because the person is very sensitive and they don't want to hurt the person's feelings, or they're afraid of backlash once they walk out of my office. So we actually give questionnaires that the person, the spouse, the loved one, can fill out in private that will communicate with us about what is it that they're noticing in real life. Once we have the tests completed and they're scored, we put it all together in something called a neuropsychological report. And this is really the 5th element of the neuropsych eval, the gold standard, because someone has to integrate the information, right? It's no good if we've got all these little bits and pieces. One thing that we love to do as neuropsychologists is not just be overly specialized in the brain. Remember I was saying before, it's so important that we interpret brain issues in terms of the person, their family, their social context, their selves, right? The history of their lives. What did these things mean? So what we do is we bring it all together into a comprehensive report that we then share with the person and their loved one who came to the interview in something called a feedback evaluation. And this is where we get super clear on what the diagnosis is. We are so good, I have to tell you, we are so good at figuring this stuff out. And we take a lot of pride in the figuring out. But what I love the most about what I do is actually the communicating about what it is that I found. And this is what I think you would really find if you went to a neuropsychologist, is that there really is an art and a science and a sensitivity to giving the feedback. You can't just blurt out insensitively, yeah, we figured this out. Yep, it's Alzheimer's disease. I mean, that is not therapeutic. That is not helpful. It's really something that you have to be well trained in, and I think just kind of naturally suited to do. But that is really the point of doing this whole evaluation, is to get to that point, that moment, that time in that room where you are getting the feedback. Okay, what the heck is going on? We've been so worried. We've been going to all these doctors. Please, we want the answers. Once you have the answer about what this is, and many times, like I said, it's not one thing. It's many times 3, 4, 5 things. Then, now we know our map, right? We know where we're starting. What we really care about is the next step. And this is why you go through the whole evaluation, is to get to this next point, which is personalized care. What can I tell you to do now that will actually help? I'm not just throwing darts at a board and thinking this would help anyone. What will help you specifically? So the rest of that appointment, which should also be an hour, this is what's going to help you in your community. These are the medication recommendations that I have to go back to either your primary care or your neurologist, because you do want to remember, psychologists, unless you live in Louisiana or New Mexico, we are not prescribers. What we do is we recommend general classes of medications back to primary care or neurology, but it's always going to be at their discretion, okay? They have to review and agree with what we say. Our job is to communicate within the family about how to make sense of symptoms, how to respond. So many families are desperate to know, what do I do? What do I do when he doesn't remember that word? What do I do when they can't remember how to get to the doctor that they've been to 10 times? So a good memory evaluation should inform you about the proper way to respond, okay? You should leave feeling like, I am no longer in this alone. I have someone that gets it and that cares. Those are two such important things. Okay, of course, there's a whole life after diagnosis. A good memory evaluation should always conclude with a follow-up plan. When are you going to come back and see me? We do have to, between evaluations, 9 to 12 months is the minimum. Medicare specifically will pay for a person to come 1 time per year, but there are also ways that we can follow people at 3 months and at 6 months. Excuse me, and I often do that because I want to know what is the response to medication. Specifically when someone gets a big diagnosis like Alzheimer's disease, I'm not going to just say, hey, see you in 9 months. No, I want them to come back maybe even in 3 weeks, because we don't want to overwhelm people. People need time to adapt and to adjust. So it's really based on the skill of the clinician, kind of when you should come back. But it definitely should not be like, see you in a year. That's totally not good. I am going to just cover briefly insurance coverage, because I never think to include this, but of course it's really important and people ask me all the time. I practice in North Carolina, United States, so a lot of older adults who come to see me have Medicare and a secondary. If that's the case, so say you have Medicare and TRICARE, or you have Medicare and AARP, it is really just an office copay. Sometimes people do have, if they're younger, they have insurance companies that won't cover it. But you can definitely, in the authorization process, try to justify what we call medical necessity. So basically, you can have a doctor reach out with some paperwork to explain why this is needed and how care would be impacted if they had a thorough memory evaluation. Good neuropsychology practice will do that for you. You don't have to worry about that. If you are out there and you're like, yes, bring it on. I need to help me. I want another you. Where is another neuropsychologist? I want you to go to Google. And if you just type in, find a board certified clinical neuropsychologist, you will get taken to the page of the organization that certifies us. And you're going to be able to put in your state and your zip code, and they're going to give you names and numbers of other board certified neuropsychologists like me who are, I promise you, we're kind of similar. We're all very curious, but we're also, we're psychologists, so we're compassionate and we're interested. And I really think if you haven't worked with one of us, you would find it to be a very, very satisfying experience. You can also call your insurance company and ask them to tell you where the nearest provider is. That is it for today. I hope you feel really good about those 5 elements of the gold standard memory eval. I am really psyched for the new year. I'm really excited to meet with you more. I definitely missed doing this in it was just 3 days that we were kind of snowed in. I think I've gotten such nice feedback from people about how much they're enjoying the information and that they're feeling more empowered about brain health and more confident about how to help someone that they know who maybe has a brain health challenge. And also I think we're doing a pretty good job of increasing compassion for people who are living with brain health challenges, and that's really the most important thing to me. I'm taking suggestions on topics for the next year. If there's something that you would love for me to talk about, I would be more than happy to do that. I do have a couple ideas. Someone asked me to talk about seizure disorders, lupus, multiple sclerosis. Maybe I was thinking about doing something about some of the fraudulent products that are out there specifically for Alzheimer's disease, because that comes up time and time again. People ask me all the time about certain supplements or certain nutritional protocols that sadly, in my opinion, have very little research base. So we could talk about that. If you thought that this was interesting or informative, I would love for you to share it. It's so important that people have the tools to advocate for themselves or for a loved one. Thank you guys so much for listening, and I will see you next Wednesday. Bye.